This law does a great deal to change quality with regard to healthcare. Currently, physicians and practitioners get paid on the basis of the number of services they provide. Fee for service. Their fee is based on the number of services they provide. This law, in 2014, begins to require of Medicare that physicians and hospitals get paid on the basis of the outcomes or the health of the patients. Medicare is the largest insurance program in the United States, and by changing what is required of Medicare, the hope is that private insurance too will change to an outcomes or a best practice kind of payment system. That is, a provider gets paid on the basis of the health of their patients. Assisting in the achievement of these outcomes are a number of other components, most notably electronic medical records. Most of us remember a time in which our doctor had back rooms full of cabinets with paper records. Paper records were localized to that physician or that provider. This law gives money from the federal government and requires that all physicians seeing Medicare patients have electronic medical records. These are records that are accessible to physicians who are treating that patient, not just in that particular office. Also, this law kind of puts to the front a primary care medical home model, which is a model in which the primary care physician coordinates care, not the specialist like we currently have. If an individual shows up to their primary care physician and has diabetes, that primary care physician may not know what that patient's cardiologist or podiatrist or nutritionist is also prescribing to that patient. A primary care medical home model would put that primary care physician in the center, and they would know what the other specialists were saying. So it's a way of managing both the diabetes and the hypertension and the other chronic conditions that that individual patient is dealing with. It's a way of spreading information and having communication with the ultimate goal of a healthier patient. And this law is paying providers to have that communication and to produce healthier outcomes or healthier patients. We know that one of the most expensive things relative to the healthcare system is chronic conditions. When people have chronic conditions like diabetes and hypertension, they cost a great deal of money to manage those chronic conditions. The primary care model lessens that impact by hopefully decreasing the number of people who acquire chronic conditions, but managing chronic conditions in a much more cost-effective and open communication manner. Ultimately, this is what will produce the quality outcomes to the health of all Missourians.